I'm Sandy from the respiratory department. We're just going to show you a couple of the machines that we have here in our department that we use for non-invasive ventilation on the floors. There's 4 different devices. This first one is the V60, and we'll just talk about a few of the features on the V60 and then move on to the other devices. The V60 here on the back, or on the side, this is the air inlet, so you just want to be really careful to not drape anything across that so it's able to intake air. On the back we have device integration cable here, and then we can also do an alarm cable depending on the unit that your patient's in. And then there's a cooling fan on the back. There's 2 tanks, and we can hook up to the tanks for transport. The battery for this is a pretty long battery, so we can transport patients throughout the hospital with this machine. And then when you place the device in standby and your patient is coming off the machine after spending the night on it, then you want to make sure that you do turn off the heater. The heater start button and off button is right here. If the heater's left on and the machine's in standby, it can overheat and melt the tubing. So up close, we can see the V60. The active mode that it's in is the ST mode. This is what we call BiPAP a lot. BiPAP is a trade name, so you won't see that on any of our machines here. What you'll see is a spontaneous mode or an ST mode, which is spontaneous time. And the settings are here, so inspiratory pressure and expiratory pressure. The rate that's set is really a backup rate because this is BiPAP, so my patient is breathing on their own spontaneously. So again, this is a backup rate. We usually set the rate at 4 because we don't want, there is an algorithm in this machine, so if the patient stops breathing for a short period of time, it will kick in a rate. We don't want to set a rate on this patient. We really want them to be breathing on their own and then activate an alarm if they're not breathing. So you'll see here that this is a timed breath. You should see it showing up as a spontaneous breath. And then right here, the patient trigger. The patient trigger should be near 100% all the time. So 90-ish% is what you should see here in a patient trigger. If you see anything low like this, then that's concerning that your patient's not breathing on their own. And you're going to want to call your respiratory therapist to troubleshoot this. There's a 100% O2 boost button. And when I push that, I have a 2-minute timer that immediately pops up, and we go to 100% for 2 minutes. I can cancel that at any time and go back to the FiO2 that we have set. An easy way to increase oxygen on your patient, if you need to increase anything other than 100%, you can hit the oxygen button here and increase the amount of oxygen delivered to your patient. But then you also have to hit the accept button. Another way to do that is hitting the oxygen button again and then using the dial here and the check mark to hit accept. And then there's just a few other features here that are only comfort measures for our patients. Another setting that you might see, of course, is CPAP. I'll activate CPAP here. So it's a continuous positive airway pressure is what that stands for. And then there's just a few comfort measure features here. One other mode that you might see on the floor a lot is the AVAPS mode. And just because we happen to have some alarms triggering, we can talk about the alarms first. So the red alarm is a high priority alarm, and you heard that was a loud, that was 5 beeps, where a low priority alarm is just a lower volume and it's just 2 beeps. If you have a high priority alarm that you're unable to solve for your patient, then you want to call your respiratory therapist and take them off the device and put them on oxygen, and then we'll troubleshoot it. One of the things that can happen is this pressure line can become disconnected. There we go. We usually get a low priority alarm first, and then it will be a high priority alarm saying the proximal line has been disconnected. So there's our proximal pressure line disconnect. If I don't solve the problem, the alarm continues. But if I can discover what the problem is and reconnect the line, then the alarm will stop. So if it's something like that that you can quickly identify and troubleshoot and reconnect, then you've solved the problem and you don't have to take your patient off the machine. Something else that might come up, if their mask is too loose, which often happens in our department, if you walk in and you see that the mask is on their forehead, of course adjusting the mask will solve a lot of alarms. A low priority alarm doesn't have to be solved right away, so you don't have to take them off the machine for low priority alarms. You can just call your respiratory therapist and we can come investigate what the problem is. So here's the other active mode AVAPs that you'll often see on the floor that we deliver this machine non-invasively for. You'll see the inspiratory pressure. There's 2 inspiratory pressures and an expiratory pressure. And then an average tidal volume that we're trying to target for our patient. And then there's a comfort feature here, and then a rate, just like on the spontaneous timed mode. Again, it's a backup rate, and our patient's going to be, all the breaths are going to be on their own and spontaneous. So when your patient is ready to come off when they're ready to come off this machine, whether it's they're getting up to go to the bathroom or it's in the morning and they're ready to just come off and for the day, you don't want to hit the power button to shut it off. You only want to go into standby for the V60. So just hit the standby and it's going to ask you to disconnect your patient. I have a test lung here, so I'm going to disconnect the test lung, but normally you would just take the mask off your patient and it will enter into standby. Every once in a while, just taking your patient off will not stop the machine, and you may have to disconnect here to get it to go into standby. And then it will shift into standby. The reason why we don't want you to power it off is because when we start these machines, we do have to tell it the exhalation port that is being used by the machine, and also the mask type. Those 2 things are required in order to get the proper patient leak for the machine instead of the total leak. So just entering in standby. Also in standby, you can see that we can enter into high flow therapy here with this machine, and it will have the flow and the FiO2. Going back to standby, we can go back into ventilating our patient, and I'll pick the ST mode that we're used to seeing and activate that. And then start. So anytime you're in standby, you can restart it by hitting the start button again, and then your patient will be in the mode that it was in when you put it into standby. If the machine does get powered off, when you turn it back on, it will be in the mode that it was on when the machine was turned off. It's just you'll see total leak here instead of patient leak. And that is an important feature of the V60 to be in the patient leak here. So entering standby is the way we want you to do it for this machine.